10 warning signs from your body you must not ignore. When it is about our bodies, we all want to live in a state of blissful ignorance. We don't want to think about pain or illness or anything that could potentially be wrong with us. Our body has its own language. It whispers when something's wrong. Sometimes our bodies give us clues that something is wrong and we need to pay attention. And if we don't listen, those whispers turn into shouts. These clues are usually in the form of pain, discomfort, or other physical symptoms. And if we ignore them, the problem will often get worse. So here are 10 warning signs from your body you should never ignore. Number 1. Unusual fatigue. We all get tired from time to time, but there's a difference between normal tiredness and unusual fatigue. Persistent, unexplained fatigue, even after proper sleep and rest, is your body waving a red flag. If you're feeling fatigued all the time and it's not getting better, it could be a sign of something serious like heart disease, diabetes, depression, anemia, chronic stress, undiagnosed sleep apnea, heart problems, or even emotional burnout. If you're dragging through the day, struggling to focus, or feeling heavy without reason, it's time to get checked. It's important to see a doctor if you're experiencing this symptom so that it can rule out any underlying medical conditions. Number 2. Shortness of breath. Do you find yourself gasping after a flight of stairs or struggling to catch your breath while doing everyday tasks? Shortness of breath can indicate asthma, heart disease, lung infections, or even a blood clot in the lungs. It's not just about being unfit. It could be life-threatening, especially if it's sudden, severe, or happens at rest. Seek help immediately. Number 3. Changes in appetite or weight. Losing weight might sound like a good thing, but if it's happening without any change in your diet or activity level, it's time to pause. When you eat, your body breaks down the food into nutrients that help fuel your cells. But when you don't eat, your body starts to burn through its reserves and can end up breaking down muscle and fat to get the energy it needs. That's why sudden or unexplained changes in appetite or weight can be a red flag. If you've recently lost your appetite or noticed weight loss without trying, it could point to an underlying condition such as thyroid imbalance, diabetes, digestive issues, or even cancer. Similarly, if you've been feeling unusually hungry, your body might be signaling that it's not getting the nutrients it requires. Losing more than 4 to 5 kilograms in just a few months, without intention, isn't normal. It's your body's way of saying something is off balance. This means that changes in appetite or weight can be a sign that something is off balance. Don't ignore these signs. Your body could be alerting you to a deeper issue that needs attention. Number 4. Tearing or throbbing pain in the chest. Chest pain is never something to brush off. While it could be something as minor as acid reflux or a muscle strain, it might also be a warning sign of something far more serious, like a heart attack or angina. The chest is one of the most protected areas of the body. So when you feel pain there, especially sharp, tearing, or throbbing sensations, it should be taken seriously. A heart attack doesn't always feel dramatic. The pain might feel like pressure, heaviness, or burning. It may even spread to your arm, shoulder, jaw, or back. And it's not just about pain. Other common symptoms include shortness of breath, nausea, cold, sweats, and sudden light. If you experience any combination of these symptoms, don't wait. Call emergency services immediately. Early intervention saves lives. Your body is trying to tell you something important. Listen to it. Never ignore chest pain. Number 5. Swelling in the legs or ankles. Swelling in the legs or ankles is a common issue and often harmless. It may occur after standing for long periods, walking extensively, wearing tight shoes, or even after a long flight. In such cases, it usually goes away with rest, elevation, or proper hydration. However, persistent or recurring swelling should never be ignored. If your ankles, feet, or lower legs stay swollen for several days or worsen over time, it could be a sign of an underlying medical condition. One possibility is poor circulation, where blood or lymph fluid isn't flowing properly, causing it to pool in the lower extremities. Because the legs and ankles are the lowest part of the body, gravity makes them the first areas where fluid collects when there's a problem in your system. Potential causes include heart failure, where the heart struggles to pump blood efficiently, kidney disease, which affects fluid balance and filtration, liver disease, where low protein levels and impaired function lead to fluid retention, deep vein thrombosis or DVT, a blood clot in a deep vein, which can cause swelling in one leg, chronic venous insufficiency, where damaged veins struggle to return blood to the heart. Even certain medications, like those for blood pressure or diabetes, can lead to swelling as a side effect. These are some of the other warning signs to watch for. Swelling in one leg only, accompanying redness or warmth, pain or heaviness in the legs. Difficulty breathing if swelling doesn't go away with rest, or if it appears suddenly with other symptoms. It's important to seek medical attention. Your body might be trying to alert you to something serious. An early diagnosis can make a world of difference. Number 6. Severe headaches. A headache every now and then is common. We all experience them from time to time. But when headaches become more frequent, persistent, or suddenly more intense than usual, your body may be trying to alert you to something more serious. Severe or unusual headaches can be warning signs of underlying conditions, such as an aneurysm, high blood pressure, or even a brain tumor. It's important not to ignore these changes and seek medical advice if your headaches start to feel different from what you're used to. If you experience a severe headache which comes on suddenly, it's important to seek medical attention right away. Number 7. Sudden dizziness or loss of balance. Dizziness, or a sudden loss of balance, is more than just a momentary wobble. It can be your body's way of waving a red flag. Common causes include inner ear issues like vertigo or infection, dehydration, low blood pressure, or even standing up too quickly. But if dizziness comes on suddenly, feels severe, or is accompanied by other symptoms like numbness, confusion, difficulty speaking, or blurred vision, it could point to something far more serious, such as a stroke. In fact, sudden loss of balance or coordination is one of the early warning signs of a stroke, especially when paired with weakness on one side of the body or trouble with speech. Other potential causes include neurological disorders like multiple sclerosis or Parkinson's disease, heart rhythm irregularities, which can affect blood flow to the brain, low blood sugar, especially in people with diabetes. Medication side effects, such as from sedatives or antidepressants. Don't ignore it if your dizziness feels different than usual, lasts longer, or interferes with daily movement. And if it happens, along with other red flags like chest pain, double vision, or slurred speech, seek emergency care immediately. Remember, balance issues aren't just about clumsiness. There might be your body's early warning system trying to protect you. Number 8. Changes in bowel or bladder habits. We don't often talk about this, but we should. Sudden changes in your bowel or urination habits, like constipation, diarrhea, frequent urination, or blood in your stool, can indicate serious internal issues. These might include infections, kidney disease, colon cancer, or inflammatory conditions like IBS. If you notice a change, track it and talk to a doctor. Early diagnosis makes all the difference. Number 9. Unexplained pain or lumps. Pain that lingers, or lumps that appear without injury, should not be ignored. A new lump could be something harmless like a cyst, or it could be a sign of cancer. Persistent joint pain, swelling, or muscle aches may signal autoimmune issues or chronic inflammation. Your body is trying to tell you something, listen to it. And number 10. Changes in vision. Our eyes are amazing organs that allow us to see the world around us. But did you know that they're also a window into our overall health? That's right, changes in vision can be a sign of many different health problems, such as diabetes, high blood pressure, and even brain tumors. If you notice any changes in your vision, it's important to see an eye doctor right away. Final thoughts. Remember, your body speaks before things become serious. These signs are not meant to scare you, but to empower you. The sooner you listen, the sooner you act, the better your chances of healing. So if something doesn't feel right, trust your intuition, because your health deserves your attention. We hope you enjoyed learning about these 10 warning signs from your body that you should never ignore. We know it's not always easy to spot these warning signs, but it's important to be aware of them so that you can take care of yourself and get the help you need. If this video helped you, share it with someone you care about. And if you've experienced any of these signs, don't wait. Book a checkup, stay aware, stay informed, and most importantly, stay well, stay healthy and happy. Thank you for watching. See you in the next video.
Please like, share, comment, and subscribe to my channel.